Okay, so walking into the bedroom, and I am going to see COPD here in a second. She has a dressing change that is due. It's been per hospital policy. They're usually changed every 5 to 7 days, or if the dressing becomes compromised or is found to be not intact, or if there's like fluid under it, we would change it then as well. This one is just because it's been time. It's been 5 to 7 days. And we're also going to be administering the saline flush and the heparin for them as well. Okay, so I'm going to be performing my first check on the 3. I have my heparin and my 2 saline flushes here. First med check is done in the med room. Also make sure I have all of my supplies. I have a mask for me and a mask for them. And then I have my sterile gloves, my Tegaderm, chlorhexidine wash, my negative pressure cap, my Demo B patch protective disc, my 4x4 and my sterile drape, as well as sterile caps and a measuring device and tape and a pen. Okay, I'm going to be bringing my med room into the patient's room because this is the only table we have, and it'll be part of my sterile field and my work triangle. Normally I just like gather all this up and bring it in because they would have that in their room. Okay.
Hello.
Hi, C. My name is Bridger. I'll be your nurse today. How are we doing?
Hello. I'm good.
Good. Okay. Okay, I've been provided by the C480 here. How are we feeling?
Oh, doing pretty good today.
Good. I'm going to be changing the dressing on your central access. And I'm going to be giving you some saline flushes, which is just sodium chloride, 9% sodium chloride, and then some heparin as well. But first, I'm going to scan your wristband here. Can I have you verify your name and date of birth for me, please, C?
Oh, yes, it's XXXXXX, and my name is COPD.
Perfect. Okay, I'm also going to scan my medications in here and perform my second and third checks on them. So I have, make sure this is all correct. Perfect. So second and third checks have been done. Okay. Great. Just gonna organize this a little better here. And then we have you as having no allergies. Is that correct?
Yes, it is.
Perfect. I'm gonna I know I just asked, but I'm just gonna double check if any adhesives, so like sticky stuff on bandages or antiseptics.
No, not that I know of.
Perfect. Okay. I'm gonna raise your bed up here because I'm a little bit taller, and I just want to save my back. So I'm for a little bit of a ride here. Perfect. Gonna hand hygiene and put on clean gloves. Okay, any pain at that site up above your collarbone there where they put that central line in?
No, not that I can remember. It has been pretty good so far.
Okay, I'm gonna uncover you here. Just looking at it, there's no signs of infection, there's no swelling, no redness, no discharge at all. It does, based on the date that is put here, it is time to change this. So what I'm going to do is I'm going to set up my sterile field right now. So what I'm going to do, see, is I'm going to set up my sterile field, and then I'm going to take this off, and then clean it, and then put a new dressing on. Does that sound okay?
Oh, yes, that sounds great.
Great. Okay. Start with our drape. Do have my 1-inch margin, and we're gonna put everything I need on here. So the 4x4 is first. So I have the patch, I have the negative pressure cap on there, and then this is the Tegaderm. And then I'm just going to place my brand new packaging with the chlorhexidine wipe, the bath solution on here as well. Okay, so I'm going to put a mask on. I'm going to put a mask on you, see. This is just because this is going to be a sterile procedure, and we don't want you breathing, or me, breathing into this site, okay? So the mask's going to go on you just like that.
Oh, I hate these.
I know, I'm sorry. Hopefully we'll do this quick and we'll be off you as soon as it's on. I'm also going to have you turn away. Okay, so we have everything ready. I'm going to just prep a space to put on my sterile gloves here before I get started, just because I will have to do that here in a minute. I want to have the less time that the site is open, the better. So I'm just going to open these and put them out and ready. Okay. Okay, see, I'm going to remove this Tegaderm that's on you, okay? So sorry, it's going to pull a little bit. So I'm removing distal to proximal and keeping the catheters down so that I don't disrupt the site at all. Sorry, I know it's kind of pulling on your skin. These things are so tight. Okay. Can you thrown away? Okay, so now I'm gonna take these gloves off. And put on my sterile gloves. This whole time making sure to keep my sterile field in view so that they're not compromised. Okay. So, sterile gloves are on. I'm going to take the chlorhexidine wipe and break the seal and use my 4x4. And what we're going to do is I'm just going to lift up on the catheter lines here, and we're going to bathe this site for 30 seconds. So it's kind of a long time, I know, sorry. See, how does that feel? Any pain there?
No, that feels good. Just a little cold.
Yeah, hopefully it'll warm up here in a second. Making sure we get every little bit of it. I want to really bathe that area. Okay. 30 seconds is up. I'm going to lay that back down. I'm going to drop that away. And then I'm going to be placing this patch, which has a blue top, so blue upright. I'm going to use the same 4x4 to just lift it up, and then this slit goes right there, and it's just going to be nice and tight to the skin. I'm going to line those back the way they were. We're done with the 4x4. Okay, now I'm going to put on the new Tegaderm. So this is the sticky portion again that I just took off. So I know it feels like I just took it off, but we're going to put it right back on, okay? So we're going to center this around the dressing. And make sure that there's no gaps, and just press outward. So once this is sealed, the sterility of this procedure for this portion is done. There is another portion of this that is sterile, but not in the same way, and I'll explain that in more detail when I get to that portion. But because this is now the wrapper on this is fighting me, see?
Oh, you know they do that.
I'll win though.
Oh, okay. I believe in you, son.
Thank you. We're getting there. Okay, there we go. Making sure all the air bubbles are out. Perfect. Perfect. Make sure all this is nice and patted down. Okay, this is sealed to the sterility portion. My gloves no longer need to be sterile because this is all nice and sealed. Okay, so like I said, the gloves no longer need to be sterile. I'm going to label this dressing with my name, the date, and the time that I did this, just so that the next nurse knows when it's time to change. So let's see, it is 1945. It's April 3rd. And my initials. Okay, so time, date, and initials. This is going to go right on there. Okay, and then I'm going to measure this from the base, where it pops out, in centimeters, and out to the lumen, which is going to be 18 centimeters, which is accurate to what I had, what was written on the MAR, so that's perfect. Okay, now, so this is all done with this dressing change. Okay, how does that feel?
It feels good.
Okay,
Thanks for
good.
asking.
Perfect. Okay, so now we're gonna do the medication, okay? So like I said before, I'm gonna be giving you 3 different things. 2 are the same, 1 is different, okay?
Okay.
Okay, so first I'm gonna do a sodium chloride, which is just saline. It's the same stuff that you would like rinse your contacts with, that stuff, okay? So we're gonna put this through your, the tube, okay? And that's just going to make sure that there's still able to be fluid, or still able for fluid to go through the tube into your central line. Because we want that to be still, we call it patent. Okay?
Okay.
Okay, so I did all my checks and everything. This is the portion I was talking about that's sterile, but not with my sterile gloves per se. So my last thing is the negative pressure cap. What I'm going to do is I'm going to remove this cap, which is sterile. So the tip of this is sterile. Carefully picking up the cap, and then sterile to sterile, insert and lock in here. And then I'm going to just loosen this top cap and prime the negative pressure cap. Okay, so this is still sterile. The tip of this is now sterile. I'm going to be removing one of your old caps. Let's see here, which one's going to be the prime? Okay, this one. Okay, so remove that, throw that away, take this cap off, and screw this on. Okay. Make sure that we're unclamped here. I'm going to aspirate for blood. Okay, I see blood return. Perfect. And then I'm going to give you the 10 milliliters as ordered saline. This one, there's no special rate. It's just water, just salt water. Any pain or discomfort when I do this?
No, not that I know.
Perfect.
It's good.
Perfect. Okay, so the next one, I'm going to leave that on there just to remain, so keep it sterile. I'm going to do the heparin next, okay? This is going to make sure that there's no clotting in that line. Okay, so I'm going to give it over a minute. Because people, if you give it too fast, people can have some adverse reactions, depends kind of on the person, but I'm going to be giving it over a minute, so I'm just going to have to kind of hang out with you here. It is a blood thinner, so just know that your blood will be a bit thinner, which sounds kind of odd and scary if you don't know what it means, but basically all we're going to be doing is looking at if you have any cuts, scratches, or bruises, how are those are going to look for you. They're going to bleed a little bit more. Okay, so we're going to note the time, and we're going to give this over a minute. So I just get to hang out with you here, see, for a minute. So yeah, like I said, this is a blood thinner. It can also give you what we call orthostatic hypotension, which is a big word, a big long term for basically just being lightheaded when you stand up. Okay, so if you move, you're going to want to do it kind of slowly at first, just to make sure that you don't pass out, because some people tend to pass out when they move too quickly. Also, like I said, if you notice you're bruising a lot or you have a cut, it might bleed for longer, and that's okay. If you have a bigger cut, let us know. Actually, any cut, let us know, and we'll monitor that for you. Also, your gums might bleed a little bit, and if that happens, let us know too, because we don't want you losing any excess blood when you don't need to. Almost done. Over halfway. Almost. How are we feeling?
I'm feeling good. Thanks for asking.
Okay. Five more seconds. 2, 1. We're done. Okay, so lastly, we have another saline flush, so more sodium chloride. Okay, I want to be very clear that that's all this is. It's just another flush, so more saline. Okay, I do have to give it over a minute though, because there's still medication in this tube that goes into your heart. Okay, so I want to make sure that you don't get that too quickly to cause those adverse reactions I was talking about. Some patients get it can be kind of hard to understand, and I know I definitely struggled with it too, to first understand why we give it so slow, if it's a different medication, if it's not the same thing. It's just because there's medication in that tubing. So this is going to go over a minute too. So let's see. So you just get to spend so much more time with me. I know you're just so happy about that. If there's any pain or discomfort with this, you shouldn't really be able to feel this, so let me know if there's any pain or discomfort, okay?
Oh, thank you. We're doing good so far.
Okay, good. I'm glad. You're getting there. Almost halfway. There's half. Um, 5 seconds. And we're done. Okay, I'm gonna clamp this, because we're all done. And then I'm gonna put one of these special little caps on here, which I'm sure you've seen before. You've got them on your other ones. It's just an antiseptic cap, and all it does is keep the tip of this really important line clean. Okay, so you have them on your other ones. These are nice, fun green ones. You got another blue one here. All this does is just make sure that there's no bacteria or anything getting into that line, because it is a central line that goes right to your heart, as I said before. Okay, so all of our lumens are clamped. They're all labeled. Get that trash out of there. That doesn't belong in there. Cover you back up. I'm going to lower your bed back down. Any questions do you have for me?
No, not that I can think of.
Okay,
Thank you.
Let's get that awful mask off your face.
Oh, thanks.
You can turn your head back. Okay. Still got your call light right there. Perfect. I'm just going to clean up. If you have any like pain or discomfort or like flushing, like flushed in your face, so like you feel like your face is kind of red or cold, please let me know. Definitely would not want that. There's a very slim chance that you'll have a reaction to anything like the saline or anything, but still a chance, so please do let us know. You do have your call light right there, so that should be it. Just give us a ring if anything changes. We do want to know. Yeah, I'm just going to clean up here. Clean everything up. And then I'm going to document that I performed the procedure and the length of which the catheter was at. And then I provided education, and then I would foam out and be done.